do we have any biomarkers to differentiate patients with functional dyspepsia, right? And again, going down then, yes, you have the symptoms here. Yes, these are the main symptoms. And Dr. Saps told you you can divide them into different categories. And in general, it's been thought that the symptoms are associated with gastric emptying problems and gastric accommodation problems. So we do have a lot of testing that we can use, right? We can use gastric emptying. Some people can use accommodation. You can do the water drink test, MR imaging. So what do we know? This is what I consider the historical perspective in why the field has been, where the field has been. In general, from a historical perspective, functional dyspepsia and gastroparesis have been separated, even though there may be some overlap. The historical perspective in general, clearly showed that gastroparesis is defined by delayed gastric emptying, and it was always considered a motility disorder. It tends to be more severe, has delayed gastric emptying by definition, usually has a peripheral substrate that you can demonstrate, and usually responds to prokinetic. It used to be said that functional dyspepsia was a functional disorder. The symptoms were very mild. The gastric emptying, actually, if you look at the Gastroparesis Consortium, all their definition of functional dyspepsia tends to be people with normal gastric emptying, right? But now we know that the more you study these patients, the gastric emptying may not be as normal as you think. And there's more psychosocial comorbidity. Again, there's no specific peripheral substrate you could demonstrate in the ICCs and other things. And the treatment of the functional dyspepsia was the neuromodulator. However, when people start to ask the question, I have a very well characterized patient with functional dyspepsia. Where do the symptoms come from? Asking the question, is there a biomarker for dyspepsia? Can I differentiate a motor disorder from a functional disorder? This is where things started to get more interesting. And this is, a study done. There's here 3 publications that I can show you. This is the largest one. This is all the population, but here you see patients with gastroparesis and patients with functional dyspepsia. And the first thing that was able to be shown is that there's no correlation between the symptoms of the patients and the gastric emptying. And that's true for functional dyspepsia patients, and that's true for gastroparesis patients. So this started to raise the question that there was a lot of overlap, and maybe gastric emptying was not the best biomarker to decide functional dyspepsia versus gastroparesis. This is a study published very recently by the Ian Tax group, where he actually did, during a drink test and studying the symptoms, he tried to see what's the relation between gastric emptying normal and delayed emptying in the symptoms of the patients. And you can still see here that there was no difference in any of the symptoms, the bloating, the burning, the belching, except for nausea. Here you can see. Nausea is the symptom that seemed to be associated with more delayed gastric emptying. All the other symptoms did not discriminate patients that had normal gastric emptying for a normal gastric emptying. Again, the conclusion from his paper was that the gastric emptying testing is not an adequate way to explain symptoms in patients that you suspect have functional dyspepsia or even delayed gastric emptying. So the clinical management does not have to focus on the gastric emptying, has to focus more on the symptom pattern, and the treatments may be very similar.